About our research on non-fatal work-related injuries in Alaska. My name is Devin Lucas. I'm the principal investigator on this project. I work for the National Institute for Occupational Safety and Health, or Niosh, in Alaska as part of the Western States Division. For those of you not familiar with Niosh, the National Institute for Occupational Safety and Health is a federal government agency under the Department of Health and Human Services. Although Niosh and the Occupational Safety and Health Administration, or OSHA, have broadly similar mandates to improve worker safety and health, each agency has a different role. OSHA is a regulatory agency that makes and enforces occupational safety and health rules. Niosh is a non-regulatory agency that conducts research on hazardous exposures and outcomes in workplaces and makes recommendations for preventing exposures and injury and illness. The mission of Niosh is to provide leadership in research to prevent work-related illness, injury, disability, and death. We achieve this mission through surveillance, intervention development, recommendations to industry and regulators, and promotion of solutions through collaborations with industry and other partners. The Western States Division of Niosh has offices in Denver, Colorado, Spokane, Washington, and Anchorage, Alaska. I lead the Niosh team here in Anchorage, focusing on occupational safety and health challenges that are much different than in other parts of the United States. Some of these challenges include vast and remote oceans and lands, reliance on small commercial airplanes for travel between villages, and extreme Arctic weather conditions. For over 25 years, Niosh has worked to help improve worker safety in Alaska, a state with a substantially elevated occupational fatality rate. Recent data from the Census of Fatal Occupational Injuries shows that the risk of dying on the job in Alaska is 3 times higher than the rest of the US. And that's actually a large improvement from a few decades ago. In the 1980s and early 90s, the risk of dying on the job in Alaska was 7 times higher than the rest of the US. Fortunately, progress has been made to reduce workplace deaths. Although the Alaska fatality rate is still elevated, several times higher than the national rate. These declines have been the result of many years of work on the part of regulatory agencies, labor organizations, companies, and other groups. Throughout the last 25 years, Niosh has focused on bringing stakeholders together and supporting fatality reduction initiatives and interventions with scientific research. Given the high fatality rate in the 1990s when Niosh opened the Alaska office, the intense focus by Niosh on studying and preventing deaths was important, but the work didn't address the also elevated risk of non-fatal injuries. We know that non-fatal injuries are currently a serious problem that still needs to be addressed, which has led us to work on a new initiative to concentrate on research and prevention of non-fatal injuries. In 2016, the Western States Division collaborated with the Niosh Center for Workers' Compensation Studies to form a partnership with the State of Alaska Division of Workers' Compensation to gain access to claims data for the purpose of epidemiologic studies of non-fatal injuries. Claims data for 2014 and 2015 were transmitted to Niosh in 2017. And in this presentation, I'll talk about what we have found so far and what we plan to do next. Of course, Niosh will continue to work on fatality prevention research too, especially in Alaska's most deadly industries of commercial aviation and commercial fishing. This new initiative on non-fatal injury research adds to the impact Niosh will have in Alaska in the coming years. I'm sure it won't surprise you when I say that after we received the workers' comp data set, we quickly discovered several problems. Some variables contained a lot of missing data. Other variables had incorrect data that was clearly noticeable when looking at other fields. For instance, having a concussion of the arm. In addition, the data set did not come with data that had already been coded using standard classification systems like the Standardized Occupational Classification, or SOC, or the Occupational Injury and Illness Classification System, or otherwise known as OICS. These are widely used, validated coding systems that are critical for high-quality injury epidemiology research. Despite the many problems with the data, there were several redeeming qualities that kept the project moving forward instead of just throwing in the towel. First, each claim had useful narrative fields that described the injury and circumstances at a sufficient level to understand the basic story of the incident. Second, the sheer number of claims, about 20,000 per year, was the largest data set of work-related injuries to which we had ever had access. With the large amount of claims data at our fingertips and the narrative fields, we decided to invest the time and resources to clean and code the data to bring it to a level that would allow for new research and understanding of workplace hazards in Alaska. We used a contract to purchase data coding services to review and code each claim using the Occupational Injury and Illness Classification System, or OICS. Also, the Abbreviated Injury Severity Score, or AIS, and the Functional Capacity Index, or FCI. These codes were derived from information in the narrative fields. We also worked with a team at Niosh to use a new system called the Niosh Industry and Occupation Computerized Coding System, or NIOCS, to code SOC, Census Occupation, and Census Industry codes. NAICS industry codes were already included in the data set. These new codes were derived from a narrative field for job title and other fields such as the employer name. With the freshly coded data, we have completed an analysis of acute traumatic injuries in Alaska during 2014 and 2015. In the workers' comp data set, there were 38,111 total claims in 2014 and 15. From this, we excluded fatalities, claims that occurred outside Alaska, claims that were denied, and illness and exposure only claims. This leaves us with 33,868 acute traumatic injuries for the descriptive study. Using workforce data from the Alaska Department of Labor, we calculated injury rates by occupation. This chart shows the injury rates for the 10 highest risk occupations. The injury rate for all workers combined was 40 injuries per 1,000 workers and is represented by the line across the bars on the chart. Firefighters, police, and their supervisors had the highest risks of injury. Healthcare aides, such as nursing assistants and home health aides, had the fourth highest rate. The category of other production workers is mostly comprised of low-skilled helpers of higher level production workers. Something worth pointing out here is that Alaska's two deadliest occupations, commercial fishermen and commercial pilots, are not on this chart of occupations at highest risk of non-fatal injuries. In the case of fishermen, their absence on this chart represents an absence from workers' comp completely, because fishermen are not covered by workers' comp. Deckhands work as independent contractors, and while this can be strongly argued as a misclassification of employment, there can be an advantage in that the Jones Act allows deckhands to sue the owner of the fishing vessel for injury compensation, which can result in award amounts much higher than workers' comp payments. Other studies have shown that fishermen are in fact at high risk of both fatal and non-fatal injuries. In the case of commercial, commuter, and air taxi pilots, though, most are covered by workers' comp, so the interpretation seems to be that pilots are at high risk of death on the job, but not at especially high risk of non-fatal injuries. The previous slide showed occupations with a high risk of injury, which is important information for planning interventions because we want to bring down risk. But targeting injury prevention efforts at the occupations with the highest number of injuries is also important because a single intervention can result in huge reductions in injuries and costs associated with treatment and recovery. Through this lens, construction workers are an occupation of concern, as well as food processing workers, which category here is almost entirely seafood processors. Notice that two of the occupations on the chart, police officers and healthcare aides, were also on the previous chart as having elevated risk. For each occupation, we can examine characteristics of injuries to help inform injury prevention. In this example, you can see the causes of injuries for several broad occupations. Of course, in the analysis, we can get to a much finer level of both occupation and cause, but for showing it all in a single chart as an example of what we can look at, I'm presenting these broader levels of detail. Right away, you can see that the vast majority of injuries are caused by contact with objects, in the light blue, overexertion in the orange color, and falls, slips, and trips, which is gray. But look at the protective services occupation group, in the large proportion of yellow, which represents injuries caused by violence. Below that, we see that healthcare practitioners and technicians also have a high proportion of injuries caused by violence, but also a high proportion caused by exposure to harmful substances and environments. Drilling down into the finer details in these areas can provide valuable information to guide our next steps. It certainly has been a lot of work to clean, code, and prepare the workers' comp data, so we have to step back and weigh the costs and benefits and decide if it's worth it. Because of the potential that this cleaned up, improved data set has, I believe the benefits will outweigh the costs. We will be able to complete many in-depth studies using this data set that will inform further injury prevention research. That said, at this point, I do not believe this process can be sustainable for longer-term surveillance. By that I mean we can't afford to do work to prepare the data every year in an ongoing way. But we will utilize the data we have to its maximum potential, and we do have plans and resources this year to obtain and code 2 additional years of claims data, 2016 and 2017. Beyond that, we are also having discussions with our partners at the state of Alaska about potential improvements to the workers' comp data at the point of data collection and coding by insurance companies. If enough improvements could be made on that side of the data, it would reduce the amount of manual coding necessary on our end to analyze the data and make ongoing workers' comp research more feasible. Our next steps are to publish our findings of the overall analysis of 2014 and 2015 data. Then we hope to work on more in-depth studies of specific occupations or outcomes, and also inspire other researchers to collaborate with us to conduct more research with the data too. As I mentioned, we are getting 2016 and 2017 claims data and have the resources this year to apply the same cleaning and coding as the earlier data. Down the road, we hope this work leads to intervention development and evaluation studies. Okay, thank you, and I can take questions or comments.
Great, thanks, Devin. I see Neil Gardner has joined us. Hi, Neil, welcome.
Devin, this is Sarah. Thank you. That was really fascinating information, and I'm so glad you had the resources to pull that data set together. I'm sure I missed it. You get the data from the insurance companies. Is that how you receive the data?
We actually receive the data from the state of Alaska, the Division of Workers' Compensation at the state. Collects data from all of the insurance companies that underwrite workers' comp. So those private insurance companies are required by law to report their claims and claims data to the state. And so the state manages and oversees all of the insurers and the claims and makes sure that the process is being is following the legal framework. And so they have the data, and they use the data themselves, but really mostly for cost analysis. No one, as of yet, has used it for injury epidemiology in this way.
Yeah, thank you. I wanted to understand how you received it because I wasn't sure if, for example, an industry could opt out, but that's not the case since it's coming through the workman's comp data set, which is interesting. I also wanted to thank you for your first or second slide, which showed the difference between OSHA and Niosh. That was news to me and very, very helpful. And as I understood it, Niosh is under CDC, correct?
That's
or
correct.
Part of CDC. Okay, I never knew that. Yeah, so the last thing is, this is really incredibly interesting and useful, and I do think that there might be other agencies that might be interested in learning more about this. I'm thinking of like the Department of Transportation, the Department of Energy, potentially NSF. And so you said that you're going to publish a paper. Are you going to is it possible now to put a link to where one can go to see the summary of your data, or do we need to wait for a published article on that?
And we can link to the data in these slides that I've shared today in the presentation, but we haven't published anything additional beyond what I've presented, here today. So the paper, of course, will have a lot more in terms of statistics and findings, and we don't have any plans to publish anything additional in advance of that. But these slides have been cleared and are available for people to look at.
Okay, that's great. Thank you, Devin. Really, really interesting presentation. Thank you very much.
Yeah, thank you.
Devin, could you remind me of the timeline you're looking at for publication?
I'm hoping that we're able to submit this paper to a journal in the next month or so. And so then we will be under the journal's timeline, but hopefully it's published at least out maybe in the early view or electronically within 8 months or so, 8 months to a year, hopefully.
Thank you.
Devin, could you go back to your slide showing occupational category and risk?
Sure. Are you talking about this one, the risk?
So this is the risk per 1,000 workers, and this is, so if that firefighter had multiple claims, would it show up as 2 events, or is this annualized per person? How is this data presented?
Yeah, if a person had more than one claim, it would show up in the numerator twice or multiple times. But that person would only show up in the denominator once. These counts come from the State Department of Labor, and it's the number of unique workers in each category during the year. So, so if a person worked in multiple occupations during the year, they would show up as a count in multiple occupations. So somebody worked for a few months as a seafood processor, they'd appear in the production worker count, and then if they went on and worked somewhere else, they would be counted in the occupation groups. And then for the overall count of all workers in Alaska, they would only appear once.
Mm-hmm. So you don't really know, I imagine, how long these workers are in their occupation. Okay? So for seasonal work, like other production workers, or if that's where the seafood processors show up, you don't really have a rate per unit time there. You just have how many events per year per worker. Is that right?
Right. That's right. Unfortunately, we don't have a unit of time built into that denominator.
How
That
do
would
these
that would be the gold standard, but we don't have that data from the state, unfortunately.
how do these compare with other states who've done the same thing?
Yeah, that's actually quite difficult because there aren't many states who are doing injury research with their workers' comp claims. There, Ohio and Washington are two that have, but the problem is that they define their cases differently. So while we in our study we're looking at all accepted claims, other research with workers' comp systems looks at defines the case differently, like time lost cases. So their numerator will be or time lost claims where the person was out of work for some period of time. So we don't have any way to directly compare to other workers' comp studies in those few states that have done them or nationally.
Could you go down one more slide to show that the numbers per occupation?
I'm so curious as to why there's, or maybe it's falls in a different category that I'm just not seeing, but there's no, I don't see anything for like mining or mineral extraction.
Oh, they're on here. So these charts only show the top 10 highest occupations.
And
So
they're
there
not
are,
in the top 10.
right. So there are more occupations. They're just, extending out to the right as they trickle down. And I just included the top 10 in this
Okay.
chart.
I would have gotten that wrong on a on a multiple choice test.
Yeah, oil and gas extraction in Alaska is actually tends to be very safe. The companies on the slope have invested an incredible amount of resources into occupational safety and health, and so whereas in the lower 48, oil and gas can be very high risk. There are a lot of deaths and a lot of injuries. In Alaska, it's completely the opposite picture. They tend to be very, very safe operators up there.
Are there any of these injury classifications that you point to as kind of being uniquely Arctic or Alaskan?
Well, that's a great point. The food processing workers that have the second highest number of claims are almost exclusively seafood processing workers. And the ones that appear in workers' comp data are only those seafood processing workers that work onshore. These are workers that work in our onshore seafood processing plants. And all of the offshore seafood processors out on the catcher processors, floating factory ships and things, they're not included in workers' comp. So there's an even higher burden of injury among seafood processors that are not captured in workers' comp data. Similarly, as commercial fishermen are not captured in workers' comp data. Other workers who are not in this system are self-employed workers. So, you can imagine a lot of construction workers, contractors, who are sole proprietors. They would be adding cases to that construction worker bar, but since they're self-employed, they're not required to pay workers' comp insurance on themselves, and so they're not reflected in this data. It also misses any federal employees. Military and civil servants are not in workers' comp data either, but state government workers are. State and local government workers are in the system. So
That's
it's not a
interesting. Sorry, go ahead.
Oh, so it's not a complete picture, but it's a big chunk of the injury burden.
So Devin, this is Sarah Yoder, and I was curious, is occupational data collected by the Alaska Trauma Registry? I know there's limitations to that database, but I'm just curious.
It is. Yeah, we've used the trauma registry a lot in previous years to study work-related injuries, and yeah, anyone in the state who is injured and hospitalized as a result of that injury would be captured in the trauma registry, and they do have fields for work-relatedness and industry and occupation of the person if it was work-related, and we have used that data in the past. The major limitation, one that you mentioned, is that it only captures injuries that result in hospitalization. So we're talking about kind of more serious cases, which is good, you know, to do research on, and we have used it quite a bit in the past. One of the questions that I actually had wanted to propose to the group and maybe get some feedback on if you know, I'll have any thoughts on this, is when you think about non-fatal injuries in the workplace, you know, sometimes it's difficult for us to understand and think about how we make a compelling case for non-fatal injury prevention to companies and workers. And so I wonder if any of you have any thoughts or ideas for how, you know, how as researchers we take our findings and then make a compelling case for prevention to companies and workers. Are there any thoughts on that?
This is Sarah. I think for me, the most, I guess, obvious connection is to tie it to dollars lost by the company, you know, turning, doing some type of, you know, years lost or something that would then be calculated into some type of monetary amount.
Yeah, and that's something that we may be able to do with the workers' comp data. We haven't been able to look at the cost data yet, but we have been promised by the state that they do have costs for claims and that we should be able to look at the cost data at some point, and then you know, that might help to drive home that point, what you were saying about costs.
Mm-hmm.
It sounds like other states are looking at time lost from work, and that's a measure you would be able to add to this.
Yeah, that's true. In the data, we do have variables that that are, you know, date variables that reflect the date of the injury, the date lost time started, and then when the person returned to work, so we can calculate the number of days lost for that injury, you know, and you know, maybe tying that to these different occupations or industries or even injury types could maybe create a compelling case for certain areas of prevention, maybe, you know, maybe the worst problems.
So the big losers are the companies who lose the employees' time and the insurance agencies who have to pay out the claim, right? Those are the, yeah, so it seems like if you're monetizing it, that the both the industry, the companies, and the insurance agencies have a motivation to try and reduce these numbers. So I'm wondering, you if there's a way of thinking about this information, how insurance companies might utilize this information, and what other things would be useful for them to lower the cost that they're putting out for these claims.
Yeah, you're right. I mean, the insurance companies are the ones who are paying the claims, so they would gain the most by at least reducing the cost of the claims. Whereas the companies, they're paying their insurance premiums sort of no matter what. And so the insurance companies are the ones that have the profit incentive, I guess, to reduce costs of claims and, number of claims and cost of claims. And then the companies, they lose, in the short term, they lose productivity if a worker is out for an injury. And in the private sector and with a profit-driven company, I mean, that would be probably pretty important.
Well, and I would imagine there'd be a much smaller number of insurers than there are companies, and that the insurers probably cluster around industries. So it would be easier to collaborate with the insurance companies on how to utilize this information and provide tools and techniques and for lowering injuries. It just seems like it'd be easier to work through the insurance companies.
Yeah, that's a good point. I mean, you're right. There are definitely fewer insurance companies, so working with them might be a good thing to explore. I've never really, I don't know a lot about the insurance companies, and I haven't looked into that side of it very much. We tend to get kind of tunnel vision and working with workers and companies, but like exploring the insurance company side of it is actually quite a good idea.
Yeah, I'm just thinking about, I saw a study, a year or so ago, I'd have to dig it up, about how insurance companies are driving construction in coastal zones, like in North Carolina, in Miami, where sea level rise is not only in the future, it's beginning to happen now. And the fact that the insurance companies will be the ones that ultimately move construction inland, because they will refuse to insure properties that are too close to the coast. So I think there could be I'm thinking about something like a toolkit that insurance companies could put together, working with companies to lower safety in the areas that you've identified where there's a problem.
Yeah, that's a really good idea. Thank you for that.
And Devin, it looks like you've already begun the examination of what the specific injuries were. I think the next slide even has it. We begin to classify those. Some of them are going to be more preventable than others through engineering designs or things that could be provided to workers to prevent particular parts of that. I'm trying to think of, this obviously better than any of us. So when you kind of look at some of the food prep issues, are they provided with adequate protection in the preparation field? And I think about seafood workers, wearing a Kevlar glove on the hand that doesn't hold the knife, for example. Things that are probably well established that can make a difference in injuries. But that's going to be one of your next steps, I suppose, is to look at the preventable fraction of this, or as much as you can.
Yeah, and I think we may find that there are existing solutions that maybe aren't being applied yet to certain industries or big companies in Alaska. And so maybe there are interventions that don't involve creating something new, but finding what other people are doing outside of Alaska at some high performing company, and trying to translate what they're doing to companies in Alaska. So maybe poultry processors in the lower 48 are doing something to prevent lower back injuries among their workers that we could import to seafood processors in Alaska or something. Similar industries, or looking at similar problems elsewhere that maybe some companies are doing better at controlling.
Yeah. Your point about the oil and gas extraction industry in Alaska being safer than in the lower 48, there's probably an interesting story to be told there. Maybe it's already been well documented, but I think those compelling anecdotes of good practices and maybe changes in hazard rates over time can point out a general approach and maybe some specific applications that could be used by other industries.
Yeah, that's a great point. Yeah, I appreciate that.
Yeah, and on the flip side of this, not that this has any so much for help with how you move this data into a practical realm, but it was really interesting to me to hear that Alaska is a much safer state for oil and gas extraction than the lower 48. And I wonder if there's ways of, within Niosh, of sharing that information with other parts of the country, because there certainly has to be lessons learned there.
Yeah, and actually,
it's counterintuitive to me that in that harsh environment, it's safer than in a place where you're not dealing with all the elements that you're dealing with in Alaska.
Right. Yeah, and I actually don't think that story has been told, to Tom's point, and that would probably be a great exploration of a lot of times we focus so much on the problems that we don't look at the high performers and tell the story of a company or an industry that's doing exceptionally well. So telling that story of the Alaska oil and gas industry and how things went from probably very bad to very good would be a great anecdote. And I wonder, I'm not sure what the avenue for that would be, but it almost seems like more like it'd be a great piece of journalism to tell that story, but to think about that.
Devin, a couple, just to shift the conversation a little bit, thinking about the Arctic as a region and some of the activities going on in occupational health and safety in other countries. We heard about, during the Finnish chairmanship, an effort by occupational safety groups in Finland to create an Arctic network on occupational health. It was proposed as an Arctic Council project, and it may still be in the information gathering stage, but basically to create a community and network of folks involved in the kind of work you're doing. I'm wondering if you've been in contact with any of them or have heard about this Arctic Occupational Health Network.
Yeah, absolutely. Yes, I participated in a couple of the early meetings surrounding that network, and and I joined that group. But actually, it's good that you bring that up, because I actually haven't heard anything about it in the past few months, and I'm wondering what the next steps or the plan is for that network. But yeah, that was out of Finland, an initiative that they were starting, and there definitely seemed to be some initial traction and gathering into the network, and I'm not sure what is happening with it right now. I need to look into that.
It seemed like a promising area, and because there's many of the same industries across the Arctic and harsh working conditions and similar challenges, so kind of a natural opportunity to share lessons learned, good practices, emerging concerns, or emerging solutions. And it might be something we'd look out for in the future. I could see if it does develop into something more, we might consider adding it as part of a Arctic research plan too, as an element.
Mm-hmm. I agree. Yeah, I will reach out to the leaders of that network and kind of get an update of what's going on with that.
There's another aspect to that in the Arctic Council endeavors to. There's been some work to look at oil spill response and collaborations around a reaction to potential oil spills. And I thought Niosh was involved in developing some of the worker safety recommendations, or at least reviewing those. Is that something you're familiar with?
Yeah, it seems like it was a little bit ago, and we did have a couple of Niosh folks on that group who put together, who contributed to that document. There was a document that was published on Arctic oil spill response, an assessment of the current preparations, and then what's needed in the future to be better prepared to respond. And yeah, there were Niosh, some Niosh participants to that work group and product.
Is there any ongoing activities of that group that would be worth tracking or being aware of?
Not that I'm aware of, but yeah, that's something I can look into.
Others may have questions, but I have one other question, and maybe you could help kind of clarify the scope of what you're involved in. One issue that has come up at times is some of the injuries or fatalities associated with subsistence activities and the potential increase for those in a changing Arctic, falls through the ice, drownings, those kinds of things. Those have been identified as areas of concern, but as I understand it, those subsistence or recreational activities aren't really, first of all, they're hard to capture, and secondly, aren't really within the mandate of your organization. Is that a fair statement?
Yeah, that's right. We don't track subsistence related fatalities or injuries in our surveillance systems. They fall outside of the generally accepted definition of occupational injuries and fatalities. So in the past, I've been involved with some research here in the state just because I'm here on subsistence related drowning deaths, and we published some findings on that a few years ago. But there are some great researchers over at ANTHC in their injury department that do subsistence related research out of the villages and things, and so they definitely have a better finger on the pulse of that issue than we do.
Yeah, I remember an effort to try to capture changes in rates of people falling through the ice, thinking that would be something that would change over time in Alaska. The kind of surveillance data that you show from, that's routinely captured, although imperfect, at least you have a capture system for these occupational related injuries. But this group that was interested in falls through the ice kind of had to resort to newspaper stories and other press reports, which is one way of doing that, but you just know that many of them are missed, and it's an insensitive system.
Right. Yeah, and there are some other methods that I can imagine using for death related research. You can also turn to death certificate files and work through that system to help identify cases. Information as well, but
Devin, in looking at these research objectives that we have in the Arctic Research Plan, are there any suggestions you'd have about changing these or adding to them to capture any of the trends that you see coming up in your work?
You're going back to the performance elements?
Yeah.
Oh, okay.
I mean, we basically have two. One is related to epidemiologic surveillance, and that's what you presented today, and then the other was research on prevention. But I was just thinking if there's other areas you are involved in that you would want to see reflected in the research plan.
I think we could take a look at modifying these and adding about adding a new element or just editing these to add more detail or breadth to them.
Either of those is possible. It's supposed to be a living document, and we can modify language in there if it doesn't really reflect what's going on now, or add other elements if they're needed.
Okay. Right. Yeah, I think we can definitely go back and take another look at these. I think Meredith mentioned that earlier on the call, or maybe before the meeting actually started. We talked about potentially looking at these again and maybe making some revisions.
Just looking forward, the health and wellness collaboration team is going to meet in June, June 4th and 5th, I think, Sarah. I got that right? In Anchorage, and the idea is to modify or make any changes to the plan that might be needed, or plan for the coming year. So there is some time set aside to reevaluate this.
Okay.
That's correct. So ideas, it would be good to get some ideas prior to that meeting, because all the teams will be meeting together too. So if there are, if this would be of relevance to the Coastal Resilience Collaboration team or others, then we can also make those connections. But it would be helpful to get either new performance elements or clarifications to the existing ones. Given that the work you've done, I'm sorry that when I looked at these performance elements, I did not understand, because this is completely out of my realm, but that this would fall under 1.6.1. I thought what you were talking about today fell under 1.6.2. But now, just listening to Tom, I think maybe you have completed 1.6.1 with the work that you've done now. And I'm thinking what we were talking about earlier, which is the prevention-oriented research would be the next step, and maybe defining that in a little bit more detail. Does that sound about right, Tom, or did I get that all wrong?
Well, I think Devin did make note that although the data they presented today was from 14 and 15, they're going to get the 2016-17 data set and reassess that. So it sounds like there is still more work to be done on the surveillance side.
Okay.
And then they would, you're right, Sarah, move forward into performance element 0.2, which is related to prevention research.
I think we can do a better job writing these elements and making it more clear exactly what we're doing.
Yeah, we'd be open to.
They are somewhat vague. I understand how they could be confusing.
Great.
So who is participating or invited to participate in the June in-person meeting? Is that just the leadership, or is it everyone?
It is just the team leaders. Yep.
Oh, okay.
So I think working closely with Tom on that would be the best way to proceed now.
Okay.
Yeah, so Devin, the coordinators or the leaders for the health team are myself, Sarah Yoder's on the call today, and then Dorothy Castillo from National Institutes of Health, whose focus area is really in mental health. But that's the three of us currently are engaged in that work, and I'll be transitioning that to Mike Bruce in April, so he'll be picking up that role from Arctic Investigations on the infectious disease side. So Sarah will be the anchor for that group. But if you have changes that you would like to see made in those performance elements, we could certainly have a separate conversation about how to make those line up better with your work and reflect what you have upcoming.
Okay. Yes, that sounds good. Great. Yeah, thank you.
Sarah Bodden, I don't know how you feel about minor wording changes to the research plan. I mean, is that okay, or
Yeah, it definitely is. I kind of feel like if they're clarifications, then there's no need to run it by anybody. If it is a new element or a substantial change in the element, like we're not going to do this, but we're going to do this instead, then that I feel like would need to be run through staff group. But if it's a clarification that is the leadership believes is relatively minor, then that can be done just within the team.
Okay. Any other questions from the group? Let's see, we're a little bit past the top of the hour, but as long as we have Devin here.
I'm just really glad, Devin, you gave that presentation today. I learned so much from that, and I congratulate you on the work.
Yeah, thank you. I appreciate that. We're a pretty small group here, but we like to think that we do big research and have an impact.
Great.